Hi, Sophie.
Hi, Shihab. Thank you for having me.
It's a great honor because I've been following you. When I first saw you?
I do not. Oh,
Do you
the
remember this?
Economist session
Yeah,
recently
yeah.
Ah,
Like
nice.
Abu Dhabi Health Week.
on chronic diseases, non-communicable
Yes,
diseases.
yes.
Yeah, that was a good session actually.
But you were not in the panel, but I was in the audience. And I mean, during the Q&A session, I noticed one lady, very enthusiastic, and she spoke quite eloquently, and she's got more knowledge and insights than the panelist. And I was wondering, who's this lady? And then you introduce yourself with the NABTA founder or something. And I didn't quite get that. What is NABTA? Because, and then I started Googling and I checked with someone else. Oh, it's a NABTA, is a women's health. And then I immediately looked you up on LinkedIn, and I found your NABTA. So that is how I found you.
Oh, amazing. Yeah, that was a good session. I would say that.
You spent the whole day there, or just for that particular session, you drove all the way to Abu Dhabi and
two roundtable sessions. That one, and then there was a session that was hosted by, do you know Scott Armstrong of mental health? So I attended that one as well. And they were both good. I think if I think back to when we founded NABTA in 2017, there are so many more thought leadership type events that happen now with a much broader community. More roundtables, more sessions looking at policy, not just what are people doing in other parts of the world, but how can we really lead and drive the discussion here in the UAE? These are my favorite events to attend now.
so events like those, the talks like those, the policymakers, they sit on the table and have that conversation. And do they really do something? I mean, there are actionable thing happening afterwards.
I think so. I think it can take quite a long time.
Okay.
You know, if I look at the work we do in women's health, which is essentially to bridge the gaps in access, in coverage, most of the big shifts that happen within the ecosystem are prompted by a policy change. For example, a change to the essential benefits plan. You know, there was a big update to the essential benefits plan. So the basic mandated health benefits that everyone in the UAE who has a visa is entitled to. They added mental health, they added some dental, they added some support for chronic diseases like renal failure, so they added kidney dialysis. There were a few different bits that went into the essential benefits plan, but probably if there is to be a systemic shift around postpartum care, for example, which is today not provided or covered as standard, or menopause care, or even preventative care, so making annual health checks mandatory for the population, the place you would see those changes happen first are at a policy level and through a vehicle like the Essential Benefits Plan. So I also know from experience with NABTA, we were in R&D for 6 years. We started commercializing.
R&D, prior to launching of
Prior to officially launching and starting to commercialize NABTA, we were in research and development for 6 years.
Here in the UAE or
here in the
else?
UAE, and we were very vocal. We still did a lot of community outreach. We participated in a lot of competitions.
So when you say you vocal, you directly engage with the policymakers and push certain agenda, or you push your sort of findings so that they get convinced and those bring into legislation, something like that? Or what do you mean by vocal?
So we were the first women's health technology company in the Arab world. There was no women's health technology company here before us. When we established NABTA, there were only a couple of venture capital funds investing in health technologies. There still are only a couple that are kind of dedicated health tech funds. TVM Capital is one. It's a venture capital fund, but still takes more of a private equity approach.
Is NABTA Healthtech company or healthcare company?
We're a healthcare provider, but we're a hybrid healthcare company that is fundamentally tech enabled. So what we do could not happen without the use of artificial intelligence and other digital technologies.
Okay, so not purely technology, I mean, health tech company, you're building technology in order to serve your patients and deliver better care. So health tech and healthcare services company. Can I say that? No.
Yeah, so
Okay.
we would say we're a hybrid healthcare
Hybrid
company.
healthcare.
In fact, we developed a whole thesis around it. So we coined the term in 2018.
Nabta means what?
Nabta means plant in Arabic,
Oh, okay.
with a connotation of blossoming, like a seedling. So the idea is that we follow women as they blossom over the course of their lifetimes. But hybrid healthcare, the basic pillars are patient centricity, decentralization, and augmented intelligence.
So what do you mean by decentralization? The other day, one of my first guests in the podcast, he talked about decentralized medicine. So what is decentralized in your definition?
So at the moment, in order to receive specialty support, specialist support from a cardiologist, from a gynecologist, from a neurologist, you need to go and see the specialist. And most of the knowledge and the access and the medication and the tooling is held by the provider. So even today, you cannot get, so let's say, for example, I am living with vasovagal or autonomic dysfunction, which in fact, as of about 2 weeks ago, I am. Probably at some point, in order to rule out certain things, I need to book an appointment with a neurologist. Probably I need to have a brain MRI. There is absolutely no way with healthcare being centralized today, especially specialist care, that I can access those things outside of a provider. But as a result, they're much more expensive, and it forces me to go and see that doctor where they are. So it takes more time and more money from me. And that's the same with most of the specialty care that you get. You as the individual have to go and see the specialist. They have your medical record, they send you for the tests, but where they are, you do the diagnostics, you do your labs, your radiology, you do everything where they are. It's very centralized. And that is where the healthcare is, and you go to it. And
Okay, so your approach is decentralized.
Our approach is decentralized.
Okay, so which means, in the patient standpoint, what are the benefits?
So in the cost and time. So in the most simple way, without impacting quality. So you have this triangle: quality, time, cost.
Okay.
And usually you can't have all three things. There's you sacrifice one of these things if you get something at a lower cost or in a shorter amount of time.
Yeah, delayed care is a denied care. Maybe.
Yeah.
Yeah, some sort of.
So at today, you have to go to a doctor, to a healthcare provider for everything. We envisage a world where most or up to 80% of all specialist care comes to you where you are, whether you're at home, at work, or on the move.
Okay.
So you should be able to talk to a neurologist virtually. Ideally, you should be able to do whatever recommended diagnostics it is at point of care where you are. Even things like MRIs at some point in the future should be able to come to you as opposed to you having to go to them. So today we have a provider-led and provider-centered model of care, and it's expensive because then you have think of the run costs of a hospital. You have to maintain a huge building that you are air conditioning with sufficient medical waste, with sufficient administrative and logistical support, facilities management, all the doctors, everything, all the consumables, all of the different licenses you need. Now, if you didn't have to maintain that entire infrastructure, but you still had the same modular components, the same diagnostics, the same practitioners, and you could put them wherever you wanted, and then you could make that care available virtually or remotely to individuals where they are.
So decentralized, fragmented, but
not fragmented, actually. In terms of physically, not co-located physically, but actually much more unified in terms of the continuum of care around the individual.
It's more mobile. It's more sort of dynamic.
Yeah, and if you insert between the person and the clinician a layer of artificial intelligence, that can process billions of data points, where the average specialist, probably at the time of qualifying, holds only 25 to 30,000 data points in their head. A data point could be a part of the body, a disease, an aspect of a disease, like you break all of the knowledge of an individual specialist down. Every specialist holds 25 to 30,000 data points at the point of qualifying. The thing that artificial intelligence is good at doing is pattern recognition. So taking huge amounts of information and making sense of it. So if you can then take all of this specialist knowledge and pass it through an artificially intelligent layer, you can probably reorient 80% of the advice that a specialist would give at a fraction of the cost around an individual without them ever having to see an actual specialist.
Okay.
So this is what we are working towards. We're working towards a model that doesn't rely on the person always going to see the doctor and spending a fortune to do so, but rather a model that with the support of AI and other technologies, you can have everything coming to the person instead.
Okay, so what sort of proactive support you're getting from providers network? Are they encouraging you, or is there any backlash or setbacks?
It's a very good question. So we were, in 2022, we tried to come out of R&D for the first time.
So you founded in
2017.
2017, and 5 years
6 years in research and development.
Okay.
Started commercializing in 2023.
Okay.
Probably got our product market fit from middle of 2024. So have been effectively commercializing for the past 12 months.
Okay.
In 2022, tried to come out of R&D with our platform, what we call our sovereignty architecture, this artificially intelligent layer.
This sounds a little bit like a change making or against the status quo. There is a change happening, right?
100%.
Yeah.
Yes. Big cultural change.
Yeah, the pushback from maybe providers.
Massive.
What about the facilities? I mean, your competition and...
So initially, we tried to come out with just the tech piece, basically, and with partnerships from existing providers in the market.
Okay.
But what we are saying is you're going to see less patients in terms of people entering your facility. But in total, there's going to be more people who are connected to your hospital or your clinic.
Okay.
So you get volume.
Okay.
You get volume, and you get recurring revenues attached to this volume of people. There are ways to do tests at a much lower cost, but the assumption is that every person would do 3 or 4 tests instead of 1. So actually the total revenues per person is roughly the same. But this shift to a kind of subscription-based, volume-based model is something that the incumbents we were working with really couldn't wrap their heads around. And within 6 weeks of trying to go to market with this setup, us with the tech, then with the healthcare, we were like, it is not going to work. So we actually went back into research and development. We acquired our first clinic. We integrated the full model in-house. And then with the full hybrid setup, we went back to market. We went back to market B2B. So we sell predominantly into companies with our subscription-based model of care to bridge the gaps in insurance coverage. We don't sell B2C, or people can buy from us directly, but we don't market B2C. We then were able, with the full hybrid model, to show healthcare providers we wanted to work with what we were doing, and to get them to buy into it that way. And so we've had much more success and we've partnered with a lot more incumbents within the market, whether healthcare providers, insurers, brokers, TPAs, or companies directly, than we did prior to having the full hybrid model in-house. All
right. So you have so far, I mean, you did a R&D for a few years, and then you launched, and then it took a couple of years more to get the product market fit. How many years have you dedicated so far?
8.
8. You've been funded by VCs or?
No, we have had no institutional funding. We have been funded to date across 3 funding rounds to the tune of $4 million, $500K, $2 million, $1.5 million from 68 angel investors.
Okay.
At seed and in the bridge that we did in 2023 when we went to market, we had special purpose vehicles so that rather than have every angel investor appear individually on our cap table, we have one special purpose vehicle that is the investor.
Is it called a syndicate? No, it's a...
Kind of like a syndicate.
Syndicate, okay. So you don't have to be available, answerable to all the 68 angels.
100, yes, I do.
Okay.
And the tickets have ranged from $1,000 up to
Okay.
$1 million.
Oh, okay, right. So part of learning about you or searching about you, I found out you're a full-time mother. So that's your full-time job. You're a full-time mother. You got 4 kids. Let me recall the names. Oliver, Eleanor, forgot other 2.
William and Annabelle.
William and Annabelle.
Yeah. I mean, I think you could say I'm the primary caregiver in our family.
Okay.
But NABTA is my, I guess I have 2 full-time
So on your
jobs.
LinkedIn profile, you're a full-time mother.
Yeah.
And as a founder and CEO, you didn't really mention the full-time or part-time, whatever it is.
Yeah.
So, okay. So being a mother and running a healthcare company, how much time does it take daily?
So I left my job with Accenture in 2014 to found my first company because this was prior to getting married, prior to having kids. I knew that a job for another company was not going to give me the flexibility I wanted to raise my children. I'm the oldest of 8 children.
This is not your first startup.
I had 4 companies in 3 years before NABTA.
Okay.
So, I knew when I was growing up that my mum was a doctor, qualified as a doctor, but then didn't practice after she had me. And she
Where are you from?
was a full-time mum from the UK.
UK, okay.
And she was there for us, very consistent presence.
Okay.
And that created a lot of stability for us. And I knew that I wanted to create some semblance of the same stability for my own children as and when I have them.
Okay.
So since I founded NABTA the day my son was due, my first son, 21st of March 2017. Since that day, I work 8:30 until 3:30 or 4:30 when I collect the children from school or nursery.
Okay.
I'm with them until they go to bed at 7:30, and then I work again. And so there's no overlap in my day. I'm either working on NABTA or I'm with the children, and I try to keep the 2 things very separate. Because for me, for my focus, for my sanity, for my enjoyment, for my efficacy, it's important to be entirely present either with the company or with my kids.
Okay. So, there is a lot of going on. There's a debate going on, like work-life balance, and you are perfectly managing that.
I would not say I am perfectly managing it. I mean, I have created for myself a schedule that works.
Okay. Do you mind sharing your schedules to the other women who want to pursue entrepreneurship, being a housewife or mother? Like, we've got some program called Angels. We recruit women. Where I come from, countryside, Kerala, south of India. Heard of Kerala, right?
Yeah,
okay. So we recruit them and we train them, most of them housewife. And then we transform them in a way that they can earn by themselves and run a small business unit, a micro entrepreneurship. And one thing I always hear from that, they're not able to manage the time because they have kids, they have husband, and they need to manage the household thing. And you're running a company, you're mother of 4, you're managing, you're juggling both.
Yeah,
So
but
what
we're
is your
very
message
lucky
for them?
here. We're very lucky. I think historically, women have often been the support system for men to allow them to succeed in their careers. A lot of the men, certainly of my father's generation, were able to quite unthinkingly get married and have children and excel in their careers because they had wives who stayed home and looked after the household and looked after the children for them, often sacrificing their own careers, their own ambitions. The reason that we live in a country that is 90% expatriates.
Yeah.
Many people don't have their families here.
Yeah.
Historically, people might have lived in closer proximity to, even with their families, who would then have been a support system for them. But here, most people don't have families. What we do have is we have help at home. There's a huge domestic employment sector here. you have nannies, you have
Okay.
housekeepers, people who provide you with that support system that in other countries, as a woman, you would probably be for your husband. And because I have a nanny, and an amazing nanny,
Okay.
who keeps our house clean,
Okay.
and if I have to go out in the evening to meetings, is there to
Okay.
not even, I mean, once the children are in bed, to be present once they're in bed, I'm able to run a company. But it would be much harder in the UK or anywhere in the world where I didn't have childcare and household support available to me. Because probably the assumption again would be I would be that support system
Okay.
for my husband who also works.
Okay.
Globally, women are responsible for 80% of consumption decision making and 80% of caregiving.
80% consumption,
Decision making.
and
80% of caregiving.
okay, interesting. Okay. Before founding of NABTA, I mean, when you founded NABTA, or before founding of NABTA, where was the first company? I saw on your LinkedIn in Pakistan. What
Yeah,
are you
I
doing
had-
in Pakistan?
I was
You lived in Pakistan?
I was there 5 times in 2015.
Okay. You're not a resident there.
No.
Okay. So
No. I met a guy, Umer Sami,
okay.
Pakistani origin in London, whose family had businesses in Pakistan, and we got chatting about an idea that I had for one tech project I wanted to do, and he said, "Why don't we do something together?" And he put money into a company that we co-founded, that then became actually a software development house based between London and Lahore. So I spent a lot of time. He's from Mardan. So I spent a lot of time between Lahore, Islamabad, and KPK, Khyber Pakhtunkhwa. So between kind of Peshawar, Mardan,
Okay.
in 2015.
So you have experience in founding companies in the UK, Pakistan,
Sierra
and in the
Leone.
UAE. Where else?
Sierra Leone.
Okay, so out of all these,
And
which
in
one do you
UAE.
think the best environment to start up? In different angles, different sort of aspects, cost-wise, how fast can you go to market?
All very, very different environments.
okay.
I mean, all of them so different. Gosh, yeah.
So now you only have NABTA, you
Now I have
entirely,
NABTA.
okay. So
Last
okay.
8 years, NABTA.
Okay.
That was not about having a lot of businesses. It was about
Focus.
figuring out what I wanted to build.
Okay.
So I went through 4 businesses in 3 years. The plastic recycling company I set up in Sierra Leone is still operating with my business partner, Morris Mara. It does waste plastics to bricks, tiles, and roads.
Okay.
But NABTA has been my only company, and I think will be my only
What's your
company for
background?
the foreseeable future.
In technology or
Business and technology.
business
yeah.
and technology? And how come healthcare?
My parents are doctors. My father, at one point, was the National Clinical Director of Diagnostics for the NHS.
Okay.
So probably the most senior person in diagnostics in the UK. He was also a national lead for PACS, which was the NHS's first big digitalization program that brought all their imaging online. I grew up in a very medical household,
Okay.
hearing a lot of stories,
Okay.
specifically about diagnostics. He's a
Yeah, you're very
musculoskeletal
hands-on with all these
radiologist.
medical terminologies and medical.
Yes.
Okay.
Yeah. Well, I've lived and breathed women's health for the last 8 years.
Okay.
We're probably, I mean, still to date, probably the leading kind of authority on women's health in the region.
So NABTA, you have a clinic and you have a platform, a digital platform.
Yeah. So we have our NABTA platform, which is our the tech piece. We have a mobile app. We have also options for lower income populations with either dumb phones or smartphones with less bandwidth. So we have WhatsApp and SMS messaging systems as well.
What sort of services do you offer them?
So ours is, as NABTA, we've built this hybrid model designed to be accessed on subscription. So we have
Subscription means it's a monthly subscription?
yeah, it's a monthly subscription
much
fee.
do-
49 dirham or 139 dirham paid monthly.
Okay.
And with this,
What do they get in return?
you get an annual health check up front. You get a care team, 4 or 5 individuals. You get a dedicated care coordinator who's a nurse, who's available to you on chat messenger or WhatsApp, pretty much 24/7. You get, if you have the premium option, you get a more comprehensive health check, and then you get 4 specialist consultations in a year that you can use whenever you like. It's a minimum 1-year commitment. And then what else do you get?
And the clinic is, I visited your clinic, by the way, and it's quite impressive. I love the ambience. And
It doesn't feel so clinical,
no,
right?
it's not clinical.
Yeah.
It's more like a cafe, or more like a house.
Yeah.
Yeah, it's more like a house. Okay, so you're being
I feel like we should
greeted and
write this
treated
up.
like that's okay.
Otherwise, I'm going to draw shapes in it.
Okay.
I know I'm not meant to pay attention to it, but
Okay.
it's going to be very difficult to ignore it.
All right. Okay. So you have a clinic in Jumeirah,
We have a
and
clinic in Jumeirah.
and your office is in the same building.
We
or?
have a research office in the Sharjah Research Technology and Innovation Park.
Okay. So yeah,
We have a Centre of Excellence in partnership with Clemenceau Medical Centre Hospital.
yeah. So you partner with a few hospitals.
We partner with a few
Yeah.
hospitals around.
Okay. For gynecology, if we refer a patient to your clinic, and what is the process like? You take care of
So-
the whole semester. I mean,
Yeah,
till
so the
delivery.
clinic is a fully licensed polyclinic. Our primary revenue stream and focus is on this subscription-based model of care that we sell into companies. But we have standard care packages and plans that you can purchase if you visit our clinic directly. We have a range of specialists and allied health professionals. So we have family medicine specialists and GPs with a women's health focus. We have 3 now obstetricians and gynecologists, one more full-time than the others. We are adding an internal medicine specialist, and then we have clinical psychologists, dietitians, women's health physiotherapists, midwives, doulas, lactation consultants, fertility reflexologists, and we have an amazing Chinese energetics practitioner.
This subscription covered by insurance?
The subscription is not, and it's not designed to be. So, and that's actually the point. Health insurance was originally designed, and the clue is in the name, to be accessed in emergencies. You don't take health insurance out because you expect to fall sick. You take it out in case you fall sick.
All right.
Right?
So here in the UAE, the health insurance doesn't cover for any preventative.
Most insurances won't support prevention.
Okay.
Most will exclude pre-existing conditions. Most do not provide support that is, or lot do not provide support that is not stated on the essential benefits plan. So most will not provide any coverage for postpartum care. So in the UK, for example, once you give birth, you have a midwife who visits you at home 2 days, 5 days, 10 days, and 6 weeks postpartum.
It's covered by the insurance.
It's provided
By NHS.
by the NHS.
Okay, so it's a government one.
So
okay.
it's government healthcare.
Okay. Well, so here in simple, if I buy an insurance in the
Yeah.
UAE, that doesn't cover any preventative care, any preventative
It
test.
depends on the insurance premium you get. Essential benefits plan, no.
All right. Okay.
The essential benefits plan differs depending on whether you are in the Northern Emirates, Dubai, or Abu Dhabi. The benefits are slightly different. And different insurance provider who offers the EBP will also have different plans. So, for example, you'll have some essential benefits plan providers who only provide coverage for outpatient care in clinics. So you can't get outpatient care in a hospital. You do all outpatient in a clinic and all inpatient in a hospital. And the network of providers is usually quite small. But then you have international insurance providers like Bupa, like Cigna, like Allianz, who have much more comprehensive insurance coverage, but then the policies are also much more expensive.
Yeah,
You're talking anywhere between, I guess, 3 at the very least, up to $25,000 per annum.
All right. Okay. You said done 4 years of research and development for NABTA. Give me a few findings which gave you a lot of drive, or which gave you inspiration to found NABTA. Give me a few insights, a few findings.
So I'll tell you what we learned in R&D,
Yeah.
having engaged with 25 million women across the Middle East and Africa.
Oh, in your research, part of your R&D, you've engaged with how many million?
25 million
Across the
Middle East and Africa.
Middle East and Africa.
Yeah.
So how? Through,
Socials, direct
Okay.
surveys, community engagement.
so that is a quite massive undertaking,
Yes.
logistically speaking,
Yes.
right?
I would say you can consolidate. So we learned a lot about the different gaps.
Okay. So you extracted data from different research and compiled together, or your team, your efforts directly engage with 25
Our
million?
efforts directly engage with 25 million
Wow,
women.
that is an amazing project.
Yes. So what perhaps the primary thing that came back
Did
to
you
us.
get any award or recognition for that, such a massive effort from anyone? The people who's watching this should, I mean, they should visit NABTA Clinic and buy your subscription. Someone who's
We have a lot
spent
of context.
significant time and effort and money for research and development, and came up with the product, came up with the platform, came up with the clinic. Yeah, they should trust you more than they trust others when it comes to women's health now.
I think if there's any reason that people should or could trust us, it's actually because we don't ask people to trust us.
Okay.
Our objective ultimately is health sovereignty. So we want women to trust themselves. We can empower them with access to knowledge and tools and insights across specialties. But what we want women to be able to do is to understand their own bodies enough to trust themselves enough that they know when something is wrong, they're not afraid to act on it. And when they need to act, they know exactly who they need to see every time.
How do you measure efficiency of your program or your subscription?
In goals achieved.
Yeah, like
So-
in terms of patient care or your quality of care, how do you measure your efficiency overall? You have some benchmark? Do you have some?
We do. So
Okay.
when we engage with 25 million women,
Okay.
the thing that came back to us the most, two things.
Okay.
One,
Oh, we haven't talked about the findings.
yes,
We're just
we'll
distracting.
talk about the findings. So the thing that women complained about the most, the one thing that they said they would change was along the lines of, I feel like I don't have a voice. I see a doctor and he dismisses me. I see a doctor and he doesn't listen. I see a doctor and he tells me it's all in my head. I see a doctor, he tells me it's just stress.
It's not a psychological or physiological. It's more of a societal sort of stigma.
Yeah, and a tendency to play down women's pain and to undermine their concerns and their knowledge about their own bodies. So it's the reason that I started NABTA is because my grandmother was a victim of this societal attitude. In 1998, when I was 9 years old, she died of breast cancer. She had been diagnosed 5 years previously, went through treatment, was given went into remission. She went back for her 5-year check and they told her, it's fine, you're clear. 1 month later, she started to feel desperately unwell. So she went to see her doctor, who took one look at her, saw a woman in her late 50s, overweight, and said, well, you're feeling unwell because you need to go on a diet. I'm putting you on a diet. And he put her on a diet. She lost a bunch of weight, was feeling worse, went back to see him again. And only at that point did he think maybe I should investigate this a little bit more. And then they ran the appropriate tests. But by that point, the cancer had spread to her liver. They started her on chemo and she died a month later.
Oh.
And the first finding we had from engaging with all these women, and my grandmother was an amazing woman. She had this huge voice, very big personality, extremely naughty. She stood up for everybody, adopted a Japanese family who'd emigrated and they lived with her for years. She tutored neurodivergent children through school. She was a really, really phenomenal woman, but even she could not make herself heard and was ignored and passed over and dismissed in the context of the healthcare system, and she died. So that was the first finding. And then the second thing was that in general, women are not very good at identifying symptoms as symptoms for very legitimate reasons. If you have 2 children under the age of 3, you're never going to question the fact that you're tired all the time because you have 2 children under the age of 3. But that line of thinking can extend to yawning all the time, never having enough energy, getting out of breath when you're going up the stairs, all of which are likely symptoms of other deficiencies or other underlying health conditions. And even if women do identify symptoms, there's so much stigma attached to these symptoms. What if I can't fall pregnant? What if there's something wrong with my period? I don't even want to admit that I'm having a period. What if I'm menopausal and my childbearing days are done and I don't serve any purpose within society anymore? There's so much stigma attached to symptoms that women don't do anything about them until it's too late. And as a result, 80% of breast cancers are diagnosed at stage 4. 40% of women don't attend a single antenatal appointment.
Across the world, just in the UAE?
In MENA, in the MENA region. Things are diagnosed or misdiagnosed or missed a lot later here because of the cultural stigma attached to symptoms. So we took this and we said, okay, we are going to build a technology platform that leans into something, into a part of women where there's no stigma. And that is what women want for their health, their goals. Because there's nothing wrong with, in fact, it's admirable to have a goal. I want to get into shape. I'd like to track my cycle. I want to learn more about my body. I'm trying to fall pregnant. You know, it's the flip side of a pain point. At this point, women, the stigma and the shame doesn't exist. So we built our predictive layer here. Based on the age, stage, the goal of a woman, we can predict likely symptoms that she's suffering about. We can ask her about them, even if she doesn't know that they're there or she doesn't want to talk about them. Once we understand from there what her symptoms are, we can map out a health diseases profile, we can identify risk factors, and we can provide her with personalized support. So these were the findings, and it's what drove us to build this model of care that starts with the goal and goes from there.
Wonderful. So the story of your grandmother has a lot of inspiration, founding of NABTA. I mean, a lot of...
And do you know what the weird thing is? I didn't realize until NABTA was 7 years old that that's why I started the company.
Yeah, in a subconscious mind.
Yeah, subconscious, entirely subconscious. I think I hadn't... So, I mean...
Does motherhood play some inspiration or role in being active in this space?
Yeah, so
okay.
I mean...
That is another reason, probably.
Yeah,
okay.
So if you'd asked me 2 years ago, why did you found NABTA? I would either have said, I'd have said one of these few things. I'm very wired against injustice.
Okay.
And there's a huge amount of health inequity. Women suffer significantly worse health outcomes in general.
Health inequity is nothing to do with the social class or the welfare 100%. Or the revenue or the household income brackets.
Or the race, the cultural background. I mean, health inequity could be relating to gender.
Gender is something race. Which you're really looking at, right? So something income. People overlook. When it comes to health equity, what we really look at the income. So we don't really look at the gender inequity, right?
Yeah. But we do. Also the racial inequity.
Yeah.
So if you are, and a lot of that came out during COVID. And during COVID, if you were of Pakistani origin, you were 3 times more likely to die with COVID-19 than a white Caucasian equivalent, for no other reason than the fact that you are Pakistani.
Okay. So
why?
Tell me why.
Because 92% of clinical trials today are done in the US and Europe, and where they test the drugs, the methodologies, the diagnostic tools, everything relating to healthcare. 8%, the remaining 8% are mostly done in the Far East, in places like Japan and Korea, where they have to be demographically representative for that country. So fewer than 1% of clinical trial participants today are women of Middle Eastern, African, or South Asian origin. Only a tiny percentage. If you think, the populations that are the majority in the Middle East, Africa, and South Asia are the minority, often the tiny minority in places where most of these clinical trials are conducted. And so, 70 to 80% of animal studies today only involve male test subjects because female test subjects are deemed to be too hormonally complex to give a clean result. Basically, it's going to take you a lot longer to do a study if you involve female test subjects. So easier to just include male test subjects. But it means that the drugs that we make haven't been tested on female physiology. And they haven't been tested on the physiologies of people with a genetic profile of Middle East, Africa, South Asia. And so, of course, they act differently.
Okay. So coming back to the question again, I think you forgot to answer. story of your grandmother has
Yeah.
some sort of inspiration. I'm largely inspired you founding of NABTA. And what about your motherhood? You as a mother, seeing your children and their life, the pregnancies, all these. What sort of role does
Yeah,
it
so
have?
I'd have said it was
Like being, I mean, you delivered four babies.
4 babies.
Okay. So one of your main care services is about pregnancy care, something?
We do offer some
okay.
perinatal care, so from
Okay.
conception to 12 months postpartum.
Okay. So designing certain programs, your subscription in relation with the pregnant women, or how much does it have to do with you being
My
a
personal
personal
experience.
experience?
So I definitely think that my personal health journey has informed and also fueled the journey of NABTA inevitably. You know, my journey when I was trying to fall pregnant, my journey as a teenager navigating puberty, my journey in my early 20s trying to work out how to shape my metabolic health, my pregnancies and then births with different healthcare providers, with different babies, every birth very different. Every time I've had an interaction with the healthcare system, I've ended up identifying things that I would change, things I'd want to fix, things where I've felt like I'm not actually the object of the care. I'm more an observer, even though these things are happening to my body, you know? So yes, 100% it's informed it. But again, NABTA for a long time now has been about much more than me and my personal journey. It's been informed by the collective journeys of thousands, tens of thousands of women across the region. And I think, again, one of the beauties of the platform that we have and the team that we have is that it caters for a very diverse audience. Again, I'm a white Caucasian woman. I sit within that racial bucket that has had the most research done on it. Sure, I'm a woman, so from a gender perspective, I'm subject to inequities, but I'm relatively privileged because of the color of my skin and the place where I was born. And so, yeah, I cannot be the only journey that informs the growth of NABTA. The UAE is over 200 nationalities. We have women in very different income brackets. We have women who have very different family histories, different childhood traumas, different cultural stigma, different prejudices, different gaps, different access issues. We're trying to build a model that is scalable and value-based for every woman in the region, no matter where she's from. So it can't be all about me.
The healthcare democratization. So are you a fan of public healthcare system, like universal healthcare?
Actually, I am, yeah.
Okay. So, but your home country, like NHS, we hear that NHS is failing, and I get a lot of inquiries from Indians who live there, not the Indian origin British citizen, but the students who go there.
Yeah.
They are not able to get the treatment on time, and
it's got worse since COVID as well, by the way. I mean, the UK's response to COVID, given the precarious position the NHS was in even then, was, and hindsight is a wonderful thing, the wrong one. The NHS already had a massive backlog. The NHS's big problem is wait times.
Okay.
You can now wait 52
Were
weeks.
there times in the past there were no wait times?
It's always been the issue. Again, and this is so.
Is it because of lack of resources or inadequate number of practitioners and facilities?
Limited number of specialists. It's that the access to specialty care.
Okay.
Which is when you have a centralized model is the biggest issue. It's either too costly.
So there you can't directly walk into a specialist. You have to go through that process.
You have to be referred by a GP.
How about the system here in the UAE? How different? I mean, here we can go straight to the...
You can see a specialist directly.
Okay.
The problem with that is...
So I always ask with the healthcare entrepreneurs and the public healthcare advocates, is it good or bad if patients have direct access to specialties? or should they go through GP, the physician next, and then go with that referral? Which is better? Patient standpoint, I'm not talking about anything else. So keeping patient at center, is it better for the patients to go to specialty directly or go through the usual GP
I
route?
would say that in general, the healthcare system is not designed to support people accessing specialists directly. I'll explain why. Because even if you have very good insurance, that specialist access is paid for somebody at some point. So if you have very comprehensive insurance coverage with Bupa, for example, you don't have copay on anything. You can see anybody basically and get away with it. Still, that hospital or clinic is going to be billing Bupa for every single thing you do. And if you decide that you want to see an endocrinologist one day and a gastroenterologist another day and a neurologist another day and an internal medicine specialist another day, and you want to and each of them will just see you for their part of the body, their set of diseases that they're interested in, and won't necessarily connect the dots or refer you on.
In effect, like all these claims combined and compounded, then the
Will go to the
overall
insurance
care,
provider.
yeah, then the cost is going to
cost of care is going to be higher.
Okay.
When the cost of care is higher, that affects the payer. Now, from an end user perspective, let's say your company's paying for your health insurance and they're paying for very good health insurance. I probably don't realize exactly how, in fact, I definitely don't realize how much the care is costing. But at some point, if I continue accessing specialty care whenever I like, that cost, that premium, insurance premium I have, is going to stop being profitable for the insurance provider. So then the insurance provider, looking at my medical history and my tendency to see specialists all over the place, is going to say, right, we're going to bump up your individual premium, or we're going to increase your group premium by 20, 30%. Because it's the only way we can make money on you, because you see too many people. You're seeing too many specialists.
Okay. There is another thing, another problem, which is, do you know what family physician?
Yeah.
Okay. So who knows better? Who knows you better? Is it a family physician or a specialist doctor who sees you the first time, or family physician who sees your family members for over a period of time? Who knows you better?
I would say your family medicine doctor. So that could be a family medicine specialist. It could be a general practitioner. But I mean, the generalist.
In this system of approaching directly to the specialist, cutting off the family physician and GPs, in effect, in the long term, it's actually bad for the patient, right? Cost-wise, and also...
And cost-wise, from a relationship perspective, from a knowledge perspective, from an everything perspective. It also eventually takes more time and more money from you. And at some point, again, that's it, the balance is off.
Okay.
And again, maybe you as an individual, because you have this very good insurance coverage that you're not paying for, are not affected by the access to the specialist care, but in the cost of care, because this is happening, will go up. And that might not affect you, but it will affect the people who are the low income earners, who have limited insurance coverage, whose insurance coverage then becomes more and more limited because they can't afford to pay these increasing premiums. So from a democratization of care perspective, from an access to care, people going direct to specialists, which increases the cost of care overall for everybody, is a bad thing.
Yeah. So when there was a debate in my, like where I come from, and then there are a lot of special multi-specialty hospitals coming up every town, and then there was a debate, and I said it is really bad for the community because the cost of health is going to go up, and then the family physician culture will go out, and then which is actually bad for the community long run.
Yeah, and I think again, family medicine specialists, GPs in general, because you might see them more regularly because they know you better. They will naturally have more of a prevention focus than a specialist who is an interventionist. Like they are wired to find the things that are wrong with you and to fix them. Whereas a family medicine specialist, especially a local doctor in a community who has 1,000 patients and he or she sees every one of them every year. And, they know that your son graduated from university and they know that your mother's sick. And they have that internalized medical history with you for your long-term health and well-being.
Okay.
That's a much better thing.
Also,
I don't know if you read the Harvard study that was done recently, the longitudinal study, 75-year study, looking at like the key determinant of long life.
social life is
Social connection.
Social connection is
the
most
number
important
one,
factor in terms
is the
of
most
the
important
longevity.
factor. Yeah.
Okay.
So what creates more social connection? Is it you seeing in a entirely clinical environment in a hospital, a bunch of specialists, or is it you going to see that family doctor in your town who you've known for the last 50 years, who probably delivered you?
Okay.
Yeah. It's that, right?
Okay. And NABTA is also a healthcare technology company. How much of the technology are you using on day-to-day basis?
So I think there was a period in the kind of 2010s where everything became tech, fintech, health tech, agri-tech. It's a transitional phase.
Okay.
At some point, the tech enablement of companies is going to be assumed. It won't be an agri-tech company. It will just be an agricultural company. It won't be a financial technology company.
For every company, there has to be...
It'll just be a financial company.
Yeah, okay.
Because we're moving from a non-tech enabled to a tech enabled. And then you'll have... I would say there's a category of health technologies which are not care providers, are purely there to, for example, connect doctors to patients. It's pure software. It's not providing any medical functionality. It's not providing any diagnostics or prognostics. It's literally there to connect a couple of bits of the healthcare ecosystem or puzzle. That's a health technology. Or digital technology within a health context. But the companies like ours that are tech-enabled healthcare providers will at some point just become the regular healthcare providers.
Yeah. So as a healthcare provider, you are like NABTA.
Yes.
4 years, 5 years?
8 years in total.
I mean, including that R&D.
Excluding R&D, 2 years.
2 years, okay. So which are the conditions you are coming across from your patients mostly? Just name 2 or 3 or 4.
So we have a lot
I'm
of...
sure it's all mostly lifestyle disease related.
Yeah, a lot of metabolic health issues. So things like insulin resistance, a lot of common deficiencies, vitamin D, vitamin B12, iron.
Okay.
That cause a lot of health issues, actually.
Okay.
Disruption of sex hormone profiles, all these sorts of things. Yeah, those are the
what
most
about
common
mental
ones.
health? I mean, some of your practitioners are psychologists.
A lot of stress and burnout.
Okay.
A lot of internalized stress. I mean, women
in the UAE, are they, in comparison, I mean, in your experience, women in the UK, women in Pakistan, or women in the UAE, now, because all these awareness created on socials, more women start approaching clinics physically and taking therapies and services like that. Do you think so? Do you reckon?
So I don't think there has been a comprehensive enough study by geography to answer that question. But I can tell you how you would determine the percentage of the female population that is stressed. You have externalized stress, which is the much healthier thing. People who externalize their stress usually go and see a psychologist or have therapists or people that they talk to who they help to manage their stress with. Maybe through talk therapy, maybe through something like Chinese energetics, maybe through physical activity. They're letting the stress out of their systems. Then you have people who internalize stress. 80% of autoimmune diseases, so diseases where your body starts attacking itself, are found in women globally. They now know that the majority of these autoimmune diseases are caused by chronic internalized stress. So if you wanted to understand how stressed female populations are globally, I think you would want to look at two things. You'd want to look at the percentage that is seeking support for mental health and the percentage of the population that has autoimmune diseases. And if you combine these two numbers, that will tell you...
That's the actual number.
That's the actual number. Like the percentage of women who are seeking mental health support is not indicative necessarily of the prevalence of mental health issues and stress within a population.
Okay. So for any patients, do you your clinic only for women?
We are by and for women, but we are inclusive of men and families.
Okay, so you don't discriminate or
No. Okay. And in fact, we actively encourage men, particularly male partners, to participate at the different ages and stages of women.
Okay.
For example, people don't talk about hormones in the context of men very often. But men have a hormonal profile the same way that women have a hormonal profile.
It's just not as complex as women, maybe.
And it's not as long. So men's hormonal cycle is 24 hours, whereas women's hormonal cycle is 28 to 31 days normally. The hormonal cycle of a man is fairly predictable, but a man also has different periods of hormonal activity. He has childhood, he has puberty, where hormonal activity ramps up. He has normal adulthood, and then from about the age of 40, his hormone profile changes. And this period is known as andropause. So where androgens or male hormones start to drop. For a lot of men, testosterone in particular can drop off a ledge in the 40s. And testosterone is your hormone that maintains your bone density, your muscle mass, and your vascular health. It's why a lot of men suddenly gain this belly.
Okay, so I'm
in the 40s. No. They suddenly start to gain a bit of a belly. Maybe they could eat whatever they wanted before, and suddenly it sticks. And the exercises they did before and the things that made them feel good and the way that they live doesn't work anymore, suddenly in your 40s.
So what's the solution then?
To understand your hormone profile and how it works and how to optimize it and how your cortisol levels, so your stress hormone, for example, are peaking, when they peak within the day. How do you know all this? You do a lot of reading, medical journals and healthcare publications. I'm a women's health obsessive. The thing is, when you put a gender lens on healthcare, every force has an equal and opposite reaction. As you learn more about women's health, kind of by extension, you learn more about men's health as well. So men's testosterone drops, and it's why men start to get cardiovascular disease in their 40s and 50s, because their testosterone was maintaining the health of the vessels around their heart. And suddenly, if that testosterone drops too much, their heart health suffers. The metabolism suffers.
Okay.
So it, for men to understand that they also have a physiology that requires them to relearn how their bodies work at different points throughout their lives. Same but different to women is helpful, because it means that men and women feel less alone in the struggles that they face on a daily basis. You know,
I think in this, men are ignored. Like when it comes to hormonal studies, I mean, people in various events and workshops about the hormonal sort of workshops, I rarely see people talk about men's hormones.
I know,
like that.
And it's crazy. It should be much more spoken about, because there's one of the results of that is there's still this massive stigma attached to hormones. You know, people think, oh, hormones are just a woman thing, and hormones are attached to crazy emotional behavior, crying, shouting, irrational behavior. You know, there's this whole stigma around hormones and hysteria, that actually, if you understood that men and women have their own chemical messaging systems, and these chemical messaging systems change as we age, and this is how they change, and your chemical messaging system is your powerhouse, in the same way that you can disrupt it by, you know, feeding it lots of processed food, for example, or exposing it to lots of chemicals. You can also optimize it. It's your superpower. So understanding how your body works can be massively beneficial. You know, most people, as they enter menopause or andropause, are reaching the pinnacles of their career. They're at a point where the greatest demands on them at any point in their life are being made. Their children are going to are in secondary school, they're thinking about entering university, there's a lot of financial pressure. They are in C-suite and board level positions. And it's a point in your life where you need to be optimizing for the best possible health. And understanding how your hormones work, man or woman, is a key part of that. So I agree with you. There should be a lot more workshops, a lot more awareness about.
So as part of your NABTA outreach program, I've seen some of them, some events, I've seen some video clips.
Yeah.
So you've been doing a lot of awareness campaigns, workshops and things like that. And how do you do that? How do you get these people attending? I mean, the regular people, or is it?
So we have, a couple of our most effective partnerships are with insurance providers.
Okay.
So we engage directly with, indirectly with companies through insurance providers. And our entry point into most companies is workshops.
Okay.
And our most popular workshops are those that have a gender lens on a particular topic, but where we look at things from a female and a male perspective. So we have a workshop that does a gender lens on burnout. So the different male factors and female factors that we bring into the workplace and how they burn us out. And for a lot of people, it's stuff that they've never heard before.
Okay. So how is your business doing, by the way?
So
what's your
business is
vision?
good.
So,
What's my vision? We want to be the leader in women's healthcare in the Middle East and Africa.
That's it.
We want to give all women, regardless of their age, stage, or background, access to the same high quality care wherever they are.
You're currently operating only in the UAE.
So we have a research institute in Saudi.
Okay.
We're going to start commercializing in Saudi hopefully next year.
Okay. Do you have a co-founder, right?
I don't have a co-founder.
Oh, okay.
I had a co-founder when we started the company, really my founding investor, who was with the company for 18 months and then actually for 2 women's health related issues had to step back. We brought in a new co-founder because the advice is you must have a co-founder. So we brought in a new co-founder who was our chief scientific officer for 2 years, Dr. Saba Al-Zabin. In the end, she wanted to go back to full-time lab-based research, so she did that. So
you're now solo founder.
Yeah, as of 2021, I've been the solo founder.
Okay. So I'm sure you must have good supporting staff members.
We have an amazing team. We have an amazing C-suite. We have a very good board. We have a very solid and active advisory board. And we have this massive angel investor base. Actually, one of the lessons I learned...
Having 68 angel investors, basically
I can see it giving you a bit of a headache just thinking about it.
No, it's... in your business... Look at the 68 angel investors, their networks, their families, their relatives, their friends. They will all refer to you.
Yeah. Many of them are not in the UAE, but the ones that are in the UAE are very supportive. Yeah.
Okay.
Several of them are clients of ours.
Okay.
They talk to people about us all the time. Okay. Some of them work in companies where we've been able to have access to services for free because they're an angel investor of ours. They're our greatest allies. This has not been an easy journey. There are other parts of the world where fundraising would have been significantly easier. If you look at an equivalent to us in the US, someone like Maven Clinic, they've raised $492 million to our $4 million. There is significantly more capital available for women's health technology companies outside of the region.
Yeah, I mean, VCs are obviously sort of ignoring women healthcare tech companies in the region. They're not. They might say that no, the market is so small.
Yeah,
we don't want to bet big money on the small market.
They could say that, but I mean, there are.
But there must be some impactful investors who are looking for impactful companies to invest in, or.
Yeah, there are.
Okay.
I think. There aren't many specialized health tech funds here. TVM Capital and Hikma Ventures are really the only 2.
Okay. Are you chasing them? No.
Hikma Ventures mostly invests outside of the region. TVM Capital, I actually spoke to the other day, their latest stage and with their recent fund Saudi focus, but they at some point could be a potential investor in NABTA. I like the general, the GPs, I like the general partners a lot.
Okay.
But
So when you think because I've been running a ShopDoc for about 7 years, we never focused on revenue. We never focused on our key focus was the patient outcome and whether the patient. So even I don't know, I don't feel like monetizing a lot of our services. Maybe I've got that socialism element in me. But the socialist in me actually, the capitalist in me actually founded the company, and the socialist in me holding me back. No, don't monetize yet. So are you in some kind of any sort of dilemma, similar sort? No. No. Did you understand what I mean?
I do know what you mean.
Capitalist in me.
Yes. So I think I'm someone who is very hardwired around my beliefs and principles.
Okay.
So, for example, it has been pointed out to us on many occasions that we could make a lot of money if we went into aesthetics.
Okay. Yes. While we're having this discussion, I wanted to ask you, why no aesthetics? Because that would open a lot of opportunities, a lot of revenue streams for you. But looking at your portfolios, your departments, and the kind of services offer, I did not find any aesthetic services in your.
Okay, I'll tell you why. So
Why?
There are some aesthetic procedures, reconstructive procedures, that at some point it might be good for us to introduce.
Okay.
There's a lot of obstetric violence that happens when women give birth. They end up having episiotomies, but then they have bits cut off them. They get stitched up incorrectly that can cause them pain, secondary tearing, can cause fecal or urinary incontinence for the rest of their lives. How do you address this with, you would use the same cosmetic surgeons to correct these issues as you would to do something like a labiaplasty. It can be a fine line, which is why we've not gone into it. Why? Because I guess for me, when we look at areas of expansion for NABTA and our service profile, I ask myself the question, if a woman loved her body, would she do this? And if the answer to the question...
This is very profound. Yeah. Yeah, go on, please.
And if she'd never been told to question this body, this one body that she's been given, would she do this? And if the answer to the question is no, we don't do it.
See, Al-Wasl Road, Jumeirah Beach Road, you see plenty of aesthetic clinics, and I heard reliable sources that some of the clinics making millions.
Yeah, they're very, very profitable.
Yeah, very profitable business. And you, years of R&D, and you founded NABTA, and you're doing these services, you did not include any aesthetic service. You said you include some of the aesthetic service, essential one, but not the radioplasty or Botox things you don't include. It is because your principle, the values you follow, do not allow you to do so.
Yeah,
is that right?
That's right.
Okay, so your belief is, if a woman, whichever forms the God-given sort of form she's born with, and she doesn't have to go through any extra sort of surgery,
it's a difficult one, isn't
surgical
it?
procedures to change her, to make her more beautiful, something like that.
Yeah, I mean, this is going to become very philosophical, because we are also about choice, ultimately. We want to give women the knowledge, access, tools to make the decisions that they want, but we don't have to do them. We can provide them with access to partners who can, if they want to proceed with some aesthetic procedure, then we have partners that we can send them to. We don't take referral fees. We are a value-based provider, so we neither take nor give referral fees or kickbacks. But we acknowledge that, for some women, they want to change the way that they look in order to feel that they are still young. They want to hold on to their youth. They want to hold on to it in an aesthetic way. And we don't want to carry any judgment with us. But for NABTA, within our services, we want to give women their time and their money back and enable them to feel comfortable and empowered within themselves. we don't want to create unnecessary dependencies. And we know, again, if you look at the market, that aesthetic procedures are expensive. And usually once you start, it becomes a little bit of an addiction. You don't stop. They require maintenance.
So there is another claim, counterclaim. When I did this during a debate, when I did say, I'm not a big fan of aesthetic procedure because so-and-so the reason, which I just explained. And their counterclaim was, if a woman finds herself more confident because she looks more prettier, isn't that really good for her mental health or the emotional health?
Well, yeah, but is it, as in what is it within society that has told her in order to feel confident, you need to look different to the way that you are? This kind of conformist to certain beauty standards. Like if you strip all of that away, again, I think if women were happy in their bodies, really happy, how many industries would go out of business overnight?
Yeah.
That's again, like if women were really happy in their bodies and were in love with themselves, trusted themselves, knew what they needed to function optimally, would the services we offer become irrelevant? Like if the answer to that question is yes, it's not the service for us.
Okay.
Other healthcare providers, fine.
Okay.
But we're about health sovereignty, and we're about reducing the time and cost dependencies that women have today in the context of healthcare, giving them their time back, giving them their money back. If they then want to take that time and that money and spend it on aesthetic procedures elsewhere, that is up to them. And there is no judgment on our end, but it is not something that we will offer, to our detriment from a revenue generation perspective.
Okay. So you must be having some pressure from the investors community, like the angel investors, grow fast. Are you profitable now? I don't think you are. Okay, no. So how do you deal with such a pressure? And you have and just tell me, as a businesswoman, how do you deal with that pressure, the revenue pressure, the deadline and targets?
I try not to internalize my stress. Okay. It doesn't always work.
Okay.
But yeah, I try to, as in you have to be very disciplined, right?
Okay.
Like you have to live optimally from a health perspective. Until the start of this year, I was not effectively optimizing my health. I was not getting enough sleep.
Okay.
Sleep is really important.
Okay.
Like
you're not getting enough sleep is because you have 4 children, or is it because
it was a combination of things. So I stopped breastfeeding my 4th child in February.
How old is your 4th child?
She's now 2.
2. Okay. Annabelle.
Yeah, 8, 6, 4, and 2. When you're breastfeeding, you're a little bit at the behest of your child. Like I could say I want to sleep between midnight and 7, but there was a very good chance that that would not happen. Even with small children, my 4-year-old comes into my bed most nights. But so from the start of February, I was like, right, in general, I'm getting probably 4 to 6 hours sleep every night, which is a shocking amount. And it had been like that for years. Without sleep, nothing works.
Okay.
Your cortisol stays elevated. Your metabolism slows down. Your ability to process and deal with psychological stress is greatly reduced. All of your processes on a cellular level get a lot worse, a lot slower. You have to have enough sleep. And for most adults, that is between 7 and 9 hours every night. So I was like, okay, the only way this is going to happen, because I still want to exercise as well, is if I get up before my children wake up.
Do you work out daily?
Yeah, I do.
Oh, okay.
5:45 a.m.
Okay.
So this morning at 5.
You drop your kids to school?
So I wake up at 5:45.
Okay.
I go for a walk and a run. I do some small circuits, usually in my garden, or it's hot now, so in my sitting room with the AC turned up high. Then the children come down at 7 o'clock, have breakfast, drop them at school by 8, and then I start to work. But then now, so previously I was exercising and working in the evening after they went to bed at like between 7:30 and midnight. Now I'm reliably in bed between 9 and 10. And I try to get at least 7, if not 8 hours sleep a night. It has transformed my life.
At what age you started working like full time? I saw on your profile that you work for a
20.
Belgian royal family. So what was that about?
Oh, yeah.
That is the first experience on your LinkedIn.
That
and
is,
yeah. It stays at the bottom. So
that was when I was at university in my holidays.
Okay.
I was an au pair for the King of Belgium.
Okay.
In fact, at the time he was Prince Philippe, so he was a prince, and they wanted a girl who.
What was your age then?
18, 17, 18.
So you started
19.
working at the age of 18.
Yeah, but I mean, I did a paper round when I was 11. I worked in the stables near my house, the horse stables, every Saturday for 12
Which part
hours.
of the UK are you from originally?
Just south of London,
Okay.
like Surrey.
Okay.
I did a paper round all through secondary school. I taught piano from the age of 16. So I had a lot of like part-time jobs from quite a young age. And then this was my first, I guess, proper job.
Okay.
But just during the holidays. And then my first real job, I guess, was after I graduated. So I graduated when I was 20, and I started working with Accenture just after I turned 21.
You're a Cambridge alumni?
Yes.
Yeah. What did you study there?
I read history.
History, okay.
When I was reading history, I dated a guy who was a fellow in computer science.
Okay.
Was in fact engaged to him briefly. It's another story.
So he's your husband now?
No.
Okay. So history, you were reading history?
I was reading history.
Of the British history or some foreign history?
No, a history of the history of the Arab world, actually, for quite a long time. I studied
you must have watched Lawrence of Arabia quite a few times.
Oh my goodness, I have not, but it's...
You haven't?
I haven't.
Okay.
I feel like it's a shocking film, and now I would hate it, really. I read a lot of Arab history, and then
At Cambridge, you dated a computer science guy. Okay, computer scientist.
Fellow in computer science.
Okay.
So he was a postgraduate.
Okay.
Whose PhD was on Bayesian methods for spoken dialogue management.
What does that mean?
It means he built one of the first artificial intelligence systems for voice. So back in 2008-9, there were two distinct schools of thought around artificial intelligence in the context of voice. Natural language programming and statistical or probabilistic methods.
Okay.
Today they're combined. Okay. So he built a system that used probabilities.
Is it big now in AI domain? No.
Is he? So he ended up, I spent a lot of time in the engineering department, training his machine, reading his thesis. The system that he built became a company called Vocal IQ. He co-founded it with the pro-vice chancellor of the university, a guy called Professor Steve Young, who was one of the founders of ARM, the computer chip manufacturing company. And this company was sold to Apple that he built for £100 million in 2015 and was used then to train their next generation voice assistants.
Wow. So how much of AI tools are incorporated to sort of AI voice recognition or...
Not voice recognition within NABTA, but AI is fundamental to what we do because it's the basis for our sovereignty architecture. Okay,
wonderful. So is there anything else I didn't ask you?
I don't know.
Okay. Is there anything which you would love to tell me about your NABTA, yourself, or
myself?
Healthcare in the UAE in general, or the industry? I don't know.
But I can tell you that I have ADHD. So I'm a neurodivergent individual.
What does that mean?
Autism spectrum disorder and ADHD. And existing with this on the table.
ADHD plus autism?
Yes.
Okay.
Combined.
So while you were a kid, not now?
No, now.
Okay.
100% now. I was only diagnosed last year.
Wow.
Yeah. You get lots of labels when you're growing up.
Okay, so what are the symptoms? How do I know that you have that one? If you didn't tell me that, how would I know that you had that one?
I had ADHD. So girls are very good at masking from a very early age.
Okay.
Understanding what societal expectations are in terms of behavior and mimicking them.
Okay.
My daughter, my second, has ADHD, and I see this in her. From the age of 3, she would go into school and she would behave differently to how she would at home because she understands how people expect her to behave. It was an extraordinary transition to witness at such a young age in such a tiny but very emotionally intelligent person. So how would you know that I had ADHD? This has been a perfect kind of conversation for me because it's been very detail oriented, and you have given me freedom to speak about everything that I love and am obsessed with however I want to. But I find it very difficult to pitch NABTA to people who are not in the healthcare industry and as obsessed with women's health or healthcare as I am, who don't have deep subject matter expertise, because I want to be in the detail and they expect me to pitch it at a much higher level. And I really,
how many of those
really
68
struggle to
angel
do
investors have got some sort of healthcare background experience or understand women healthcare or healthcare overall?
In
Just
total,
a percentage.
probably 20%, but
Okay.
all of them are pro-impact.
Okay.
So see what we're building and understand that the impact of it is potentially huge. How else might you know that I have ADHD? I really struggle to sit still. Really struggle to sit still. You will not have seen under the table, but my legs have been moving the entire time and my shoes are off.
Okay.
I don't like shoes. As soon as I sit down,
You
I will
flip
take my
around,
shoes
like,
off.
while you are in a conversation, do you sort of change the topic instantly? I mean,
Yes. Yeah. So opening like brackets within brackets within brackets within brackets, and then being totally comfortable writing an entire conversation without closing the brackets.
Okay. Eventually, what led you to get this diagnosed, or that?
So
how that
I went
process-
looking for more mindful parenting techniques for my daughter. And then I was standing with this psychologist, dual qualification, and I was talking to her about Eleanor. And it had been a long day. I'd come from an event and I was doing what I do a lot of the time, and I was just rocking from foot to foot because I'm rarely still. But this is a form of stimming, like emotional regulation. And I was rocking and I wasn't making eye contact with her. And basically all of the things that society expects you to do become a lot harder when you're tired. So if I am tired, overstimulated in these circumstances, you will notice that I do things that a neurotypical person might not, like continuously rocking from foot to foot, like not making eye contact and staring off into the distance. Anyway, I'm talking to her about Eleanor and some of the things that she's done, and the fact that her neurodivergence was very obvious to me from a very early age, lots of different reasons, lots and lots of different things. And she's giving me this like long, hard, steady look as I'm talking to her. And I'm like, I have ADHD too, don't I? And she was like, yes, Sophie, I think you do. And then we went through
This was when, like a couple of years ago?
This was last year.
Okay. And
just over a year ago.
So what sort of treatment? Are you taking therapy, or how does it work?
No. I mean, it was a great relief, firstly. Okay. Relief and I also I was very sad. I felt this immense grief for about 2 months because for the first time I felt like I saw myself. And I was also sad that I have been labeled so many things over the course of my lifetime. Crazy, stubborn, abrupt, lacking in empathy. I'm a highly empathetic individual, like very empathetic, probably too empathetic. And so I tend to put a little bit of a barrier deliberately because otherwise I would feel everything that you're feeling right now. And all of these labels and these things that people say about you, eventually they become the voice in your own head. And you kind of, you're a little bit, you're like, fine, I'm crazy. Fine, I'm stubborn. I don't know if you've seen the Nike advert, Dream Crazier. I thoroughly recommend watching it. The first time I watched that advert, which ends, it talks about like, it was crazy to be a woman who could do this, to run a marathon, to win however many Grand Slams and have a baby and come back for more. So if they call you crazy, fine, show them what crazy can do. And the first time I watched this advert, I cried like a baby because I felt seen. And after I got my diagnosis, I again just I grieved for a long time because I felt sad. I felt like I hadn't been seen for most of my life, even by the people closest to me. But I think it's given me a lot more self-awareness, I don't try and push myself to do things that I'm not wired to do. For example, I really
Are you more empathetic towards the people who kind of suffer similar conditions now?
I
Probably.
don't empathy was never my issue.
Okay.
Again, I'm a hyper empath. I'm
Okay.
very empathetic naturally. But it's more I realize that all of my closest friends are neurodivergent like me.
Okay.
Because
I have to do a Google search and find out more about the neurodivergent tonight. That's my study today.
yeah, it has set me free, honestly.
Okay. NABTA, are you hopeful?
I'm
Make
always hopeful.
NABTA so big that it can impact millions of women's life.
I hope so. For a long time, that question was about survival,
Okay.
existing for long enough that the kind of ecosystem and the industry could catch up. It's difficult operating in a part of the world where you don't have funds with a mandate to invest in companies that look like you. Because you exist on a shoestring and you end up being backed by 68 angel investors, which is great on the one hand. On the other hand, I have had to do a lot more work probably to raise the funds that we have than your average startup founder. So I'm very hopeful. I think I acknowledge now that everything is going to take us longer than I would like. I'm kind of made my peace with that. I appreciate the little things, the little wins, like the people we see on particular days. I appreciate them a lot more. Like, I'm here for the small incremental changes. I think I always was, but whatever fantasy or desire I had to chase exponential growth has gone. I know if we do the individual interactions and we lean into the small moments and the step-by-step, the exponential growth will come.
Yeah, so I pretty much echo and agree with you on that. Earlier I had that kind of big dreams, I wouldn't say dreams, goals, targets, and then I revisited from the learnings I've had, and then the whole outlook changed. So I want more impact. I want to become more impact driven, sort of. Yeah. And I wish you all the best for NABTA.
Thank you, Shihab.
And we will cooperate, we'll collaborate. And you're the second guest in this show. Yeah. When I started this show, I said to my people that I will only bring my guests who are impactful, unique, inspiring, not a typical ones. So you perfectly fit in that category. And thank you very much. It's been great pleasure. It's an honor to have an interaction with you.
Thank you.
So